Hello, I'm Lisa Martin from HORIBA Veterinary, part of HORIBA Healthcare, and I'm delighted to welcome you all to this continuing professional development webinar, the next in our ongoing series. We're very pleased to have you join us. All of our previous CPD content on a wide range of veterinary subjects is available to watch back free of charge at any time in the support section of the HORIBA Veterinary website. Firstly, I'd like to provide an introduction to our speaker, tell you what to expect from the webinar and a little bit about HORIBA. We're pleased to be working today with Cassie Woods, registered equine veterinary nurse and business partner at Lower House Equine Clinic in Shropshire. Cassie will be speaking on and answering your questions on biosecurity for equine teams. Cassie's interests include practice management, diagnostic imaging, medicine cases and ambulatory nursing. She also has a certificate in nurse consulting and a degree in bioveterinary science and enjoys all aspects of laboratory work. Cassie is part of the British Equine Veterinary Association Nursing Committee, and she hopes to further raise awareness of the vital role that equine nurses play in practice, to develop the role of the equine ambulatory nurse and improve training for equine veterinary grooms and technicians. She's passionate about inspiring more nurses to take up leadership and management roles in equine practice. Outside of work, Cassie is a keen rider and enjoys show jumping. In her spare time, she works closely with the BEVA Trust and has asked for her speaker's fee today to be donated to this very worthwhile charity. Details of the valuable work that they do and their past and future projects can be found via the BEVA website. HORIBA Veterinary sits within HORIBA UK with expertise in many areas of scientific testing, including fluorescence and particle characterisation, automotive emissions and energy, small and large-scale air and water quality testing. As a well-established provider of laboratory diagnostic instruments and consumables with our own local technical support, we work with medical and veterinary reference laboratories, academia, general practice and specialist settings. Our product range currently includes handheld meters running single parameter tests, higher capacity, user-friendly automated instruments, nucleic acid extraction and the first fully integrated in-house PCR testing system. Here's a brief introduction. Our LaquaTwin handheld meters work in seconds on small sample volumes for individual parameters including ionised calcium, pH and electrolytes, and all can be used patient-side. HORIBA supply and support benchtop systems for clinical chemistry testing from occasional use to specialist large reference laboratory throughput with the benefit of small sample volume requirements. These offer highly cost-effective solutions and bespoke profiles for esoteric and project testing. Our range also includes instruments for immunoassay and blood gas analysis. The Pocket Central PCR Analyzer is a unique, easy-to-use benchtop system which integrates seamlessly with any current lab provision. Within reach of all veterinary settings, each step of the PCR process is fully automated and can be run by any trained member of the practice team 24 hours a day. Up to 8 samples are processed simultaneously with results available in just 85 minutes, speeding up diagnosis times, informing case management and prescribing decisions, including the responsible use of medicines. The Pocket Central test range includes equine strangles, EHV, flu and salmonella with over 190 assays in total, enabling fast and easy testing for common and exotic bacteria, viruses, parasites and protozoa across not just equine but small animal, farm, poultry, aquaculture and biosecurity or environmental work. Very easy and reliable PCR testing is now accessible to everyone. HORIBA also work with the Equine Infectious Disease Surveillance team and strongly encourage practices to engage with them and contribute to their data. The EIDS team are a valuable resource and are available to provide guidance and support when faced with a suspected or confirmed outbreak of infectious disease. Should you have any questions, please write your query into the box on the screen and we will cover as much as possible at the end of the webinar. If you're watching us live and would like HORIBA to issue with a certificate of attendance, please provide your name and email address in the chat box, and this will be sent on in the next few days. You'll also have our contact details at the end of the webinar for any further queries or if you're watching back. The event recording will shortly be available to view via the HORIBA Veterinary website, and you'll be sent access details to enable you or any colleagues to watch back. So now I'd like to hand over to Cassie for her presentation on biosecurity for equine teams.
Good evening, everybody. Thank you for coming this evening, giving up your evening for a talk on biosecurity and equine practice. I know it's not always the most exciting topic, but it's a really crucial part of what we do every day and how we can support our patients and clients. So grateful for your attendance this evening. And thank you very much to Lisa for the great introduction. So hopefully you can learn a little bit and enjoy a little bit about biosecurity this evening. So what will this presentation cover? Firstly, an introduction to biosecurity, just to go over what it is. Common equine infectious diseases, both in the UK and abroad. And transmission of disease, so how our diseases are passed, and biosecurity for veterinary professionals, so all of us attending this evening, and how we can improve our biosecurity. Biosecurity plan for your clinic, so focusing on your clinic if you have one and how you can improve things there and put some protocols in place. Isolation, the use of it and setting up an isolation facility. I'll cover a little bit about this both in the practice and also at your client's premises too. And biosecurity for ambulatory visits. So not everybody works in a hospital or clinic environment. Some of us do a bit of both. So biosecurity for ambulatory visits is just as important because we're interacting with patients on multiple yards. And how we can support our clients with biosecurity. So ways that we can interact with our clients to get the best out of how they're providing and how they're setting up facilities on their own yards at home. I'll also briefly discuss a little bit about testing and how we can recognise disease early and how we can carry out tests to look into this more to get our diagnosis. So to begin with, so biosecurity, as I'm sure many of you will know, it refers to a set of precautions that aim to prevent the introduction and spread of harmful organisms. So why do we need to consider this? Well, it reduces the spread of disease, it creates a professional working environment, and really importantly, it ensures the protection of our patients. Also ensures the protection of our team, because remember, some of these diseases may be zoonosis, and overall it means we're working to a really high standard of cleanliness, which just gives off a really good professional image and keeps things looking good. So some examples of common infectious equine disease in the UK. There's a few here that I've listed. There's different types. So we've got some that are virus, some that are bacteria, some that are fungus. Here you can see there's a variety of animals or types of horses that could be at risk. But overall, most horses are at risk actually of these diseases, apart from rhodococcus, which is foals. But the key thing here is that all ages and all types really are at risk apart from that one. The different types of transmission, so how we're going to be transmitting these diseases, which I'll go into a little bit more further on. And in this list here, we've got two that are zoonotic. So for those of you that don't know, that means that they can be transmitted from our patients to our team, so from equines to humans. So they are salmonella and ringworm. So they are really important considerations when we're looking at what examples we have in the UK of infectious diseases. These are just some infectious diseases that we see abroad that are associated with horses. So I've just listed a few here. Again, the type here, they're all viral. all animals are at risk with EVA, particularly breeding horses. We've got one that's zoonotic, so that's West Nile virus, which I'll touch on a little bit more later. All of these diseases are considered notifiable in the UK. Why is it important to consider diseases from abroad? Well, sometimes you may want to consider working abroad. Also, you may have clients that are competing abroad, so they might be going to and from. Also, clients now more frequently import horses from abroad, so they're all areas that we need to consider and look at when we're dealing with these types of patients. So how are these diseases transmitted? Well, for pathogens to spread and succeed, they need to infect a host. So for this to happen, there needs to be a chain of infection. So there's 6 stages here that you can see on the screen. So we start with our infectious agents. So as we've just discussed, bacteria, fungi, parasites, prions. So these are microorganisms that are capable of causing disease or illness. Then we go on to the reservoir. So these are places in which infectious agents live, grow and reproduce. So examples are people or animals, water and food. For these infectious agents to leave the reservoir, there needs to be a portal of exit. So examples of these are blood, secretions, excretions and skin. And in order to infect the susceptible host, they need a method of transport, so a mode of transmission. So this could be physical contact, droplets or airborne. And I'm going to go on to these to discuss these a little bit more over the next few slides. In order to actually gain entry into the susceptible host, they need a portal of entry. So this could be mucous membranes, respiratory system or the digestive system, or even broken skin. And for this disease to have its full success, we often find that some individuals may have the traits that affect their susceptibility and severity of disease. So these are our susceptible hosts that will take in this disease. So ones that may be more at risk are those with immune deficiency, conditions such as diabetes, skin conditions such as burns. They may have had or be having surgery, and also it could be age dependent as well. It's important here to also consider the vaccine status of these hosts too. So when looking at these transmissions, firstly, here is some examples of direct transmission. So from this, we're looking at horse to horse. So this is direct from the horse to another horse via various forms. So firstly, aerosol droplets. This is quite common with equine influenza and equine herpes virus. So respiratory droplets from sick horses become airborne through coughing, sneezing and snorting. And dust can also become contaminated and particles can be suspended in the air that are also infected. Mucus and saliva, so common in strangles and influenza. So contact, and this is direct contact with secretions through licking and grooming. So that's horse to horse, licking and grooming each other, potentially if they've got an abscess, snotty nose, etc. That's how this is going to pass. And through reproduction, so EHV3 and EVA can be transmitted through natural covering. So that's something that we need to consider as our studs. And through feces, so we more really consider the passive feces in the environment, but as I've already said, you know, horses are often licking and grooming each other, so they could come into direct contact with fecal material through this, so through sniffing and grooming, etc., and being in quite close proximity. So the next form of transmission of disease is called indirect. So this is either a fomite or the environment. So many of you may have already heard of the term fomite, but in case you're not aware, so a fomite is an inanimate object that when contaminated with infectious material, it might transmit disease. So there's plenty of fomites all around us, and here are some examples. So these are the type of things that you might see in your veterinary clinic or on your client's premises. So water buckets and troughs, equipment, tack, veterinary staff, we're classed as a fomite. Veterinary equipment and so many other examples. You know, anytime you go into the clinic or you go onto a yard, so many things that you can see that potentially could be involved in the transmission of disease. So this is a really important thing to consider when you're working in the job that you do. So indirect transmission could also be from an environmental source, so the stables, the bedding that the horses are lying on, urinating, passing feces on, fecal material, abortive material. So if you've got a mare that's potentially foaled on a stud that has positive for EHV, that may become an issue. Grazing land and horse transport. Horses are often transported together, often on transporters, so that's another worry when it comes to the spreading of disease. And again, there's many more factors in the environment that we can consider when looking at indirect transmission. So whilst on the subject of indirect transmission, a really important disease to consider for this is Streptococcus equivocal, or strangles as it's more commonly known. So in our clinic, something that comes up quite often when we have a suspected or a confirmed case of strangles is that neighbouring clients and clients in the vicinity are always worried that the transmission of this is airborne. So often we find this mass panic from neighbouring yards, up to even 20, 30 miles away for positive cases confirmed. Word soon gets around via social media, etc. And it still seems to be a myth around horse owners that strangles is spread through the air. So it's not. Strangles is transmitted via direct contact with an infected horse producing discharge. So as we've just discussed, this could either be horse to horse through an abscess or a snotty nose, or it could be via people or the equipment or the environment. So if we are going from a positive strangles case to a non-positive case and we've become contaminated, then that's a way to transmit. The same as at a livery yard, if you've got a positive horse and you've got multiple people around that yard, there's risk if they're coming into contact with that horse and they don't realise that they could spread. Water buckets and troughs are also a likely source of contamination, and that's quite important for the Streptococcus equivocal. So we really need to educate our clients on how this disease is transmitted, because I'm sure many of you will have seen on social media, etc., and on some of these horse forums that clients are still under the impression that it is an airborne transmission of the disease. So another way that the disease is spread is through vector transmission. And we don't really have this in the UK, but an example of a disease from abroad is the West Nile virus, and this is the transmission cycle here in this diagram. So here we start off with our birds. The mosquitoes act as vectors, so the mosquitoes bite the birds while they're feeding on them. They're then carrying the disease. The mosquito will then go back to other birds and reinfect those, infect those other birds. So we've got a cycle from bird to mosquito, mosquito to bird that's continuous. Also, we have a second part of this cycle where the mosquito may bite people or horses. So they then become, additional contaminants. So these people or horses are then infected and become very unwell. Mainly to control this, we look at controlling the vector, so the mosquito. So we want to eliminate standing water and set up preventative ways to avoid mosquitoes, etc. But that's just an example of how vectors act as transmission. Luckily, that's not something we have to deal with in the UK. So what can we do as equine veterinary professionals to minimise the spread of disease? Firstly, let's look at the clinic. So it's important to remember that every patient that's entering our facility brings risk. So because of this, we need to formulate a clinic biosecurity plan. This involves educating and involving the team, and everyone must be following. So this isn't just one person, this should be the whole team that must be included. They must understand the need and the risk for biosecurity. So it only takes one person really to break the cycle, so we need to make sure that everybody's on board. It's important that we don't take shortcuts. So just because a horse shows no symptoms, we should always be careful, always be suspicious and not take shortcuts. It's also difficult to have a biosecurity plan that fits every clinic, so therefore individual practices should create their own. And this is really important because everybody has different facilities, different caseload, different personnel, different location. There's lots of different things to consider when designing your individual's practice biosecurity clinic plan. So some things that we're going to consider when looking at the plan. Firstly, back to the clinic team. So again, every member of the team should have received training in biosecurity and have access to the biosecurity protocol. So when we discuss a biosecurity protocol, what we mean is an actual document that should be readily available in your clinic. This could be pinned on notice board, it could even be available in PDF on iPads, etc. But it's something that every member of the team should be able to access and has read and understands because it's crucial in order to understand the goals that we're trying to achieve. So good hygiene is essential. It sounds very basic, but hand washing facilities and gel are a must and they should be easily accessible. Uniform is important for the clinic team. Not only does it create a professional image, but it also appears clean. People tend to take pride in their uniform, and we need to make sure that we're supplied with enough uniform so that we can change our clothes appropriately. PPE should be readily available and used, so things like gloves, coveralls, foot covers, additional footwear such as wellies, etc. We need to have that accessible. But we also need to consider the environment, so consider maybe even using branded reusable coveralls to create a smart look. But again, we can't really be putting these on at the beginning of the day and coming back to the clinic at the end, having seen 10 horses. We need to be changing these in between, dependent on our caseload and dependent on what we've been doing. And we need to ensure that everyone working in the clinic role is confident with the entry protocol to our clinic and is able to spot signs of possible disease. This also applies to your veterinary administration and reception team. They need to be able to identify key signs of possible contagious or disease over the phone, just in order to maybe give the vet a heads up before attending that call. So let's look more at a biosecurity plan for your clinic and what is advisable to include. So the plan should include the following: appointment of the person in charge of biosecurity. So this is going to be the person that takes overall responsibility for your biosecurity planning. They make sure things are being done properly, they produce the documents, they make sure that the protocols are being followed, they allocate the relevant training, and they take an overall responsibility of the biosecurity procedures that are being carried out and making sure that it is done correctly by everybody. We also need to recognise the risks, so this can be done as a risk assessment. Again, the reason we need to do this is because it's going to be different for every team. Some practices may not have a clinic, some may just have visiting day cases, some may have isolation facilities, so some may have operating facilities. So we need to ensure that we've recognised the risks that are going to be coming into our clinic and recorded them. We need to consider an overview of how a spread may occur, and we need to look at the fomites and examples at your clinic. So we discussed that earlier, of what you might see in the clinic and on the yard. It's actually really helpful to formulate a list of regular fomites that are coming into contact with patients at your clinic, so you can set the appropriate cleaning protocols for that equipment that you're using. We then need to, again, it sounds very basic, but how to maintain a hygienic facility. So what our goals are and what we're hoping to achieve and how we can achieve this. We need to consider the overall cleanliness, so that's all around the clinic, and that includes our reception, our offices, and any sort of shared space. And disinfectants, something I'll talk about again further on, but we need to have a record of the disinfectants that we're going to be using and the dilution recommendations. There then needs to be all of your cleaning protocols. So this isn't just an overall cleaning protocol for the whole of the clinic. We need to have protocols for each individual area because some areas are going to be used for different procedures. Some are going to require different types of cleaning and disinfection. So it's important that we can identify these areas and have a protocol for each one. Then we have to have what really should be a separate protocol, but included in your biosecurity plan is the management of your isolation facility. We need to consider the disposal of bedding. So this is our equine bedding, so shavings, straw, for example, cardboard. What are we going to do with it after it's left that horse's stable? Are there going to be different areas that it needs to go to depending on what treating and what area of the clinic the horse is in? Again, it sounds very basic, and I'm sure you all do it at home, but laundry protocols, it's really important because we don't want to be washing something that's been used on an ISO case on a very quick 20-degree wash. We need to make sure that people know how to use the laundry facilities and what needs to be washed, when, how, and any extras that we need to do with regards to that. Biosecurity and infection control in the theatre is also important to have a separate protocol for in there, because we want to very much reduce our risk of infection. PPE, so there should be a list in there in your plan of what PPE is available and when it should be used, and even perhaps how to request it or what you're going to be allocating to your team. And then lastly, we need to have a section on biosecurity for ambulatory vets. So again, for our colleagues that are going out on the road and seeing cases, they also need a protocol for how they should manage infection control. So cleaning of the clinic, a topic that is a little bit boring, I know, but it's a really, really important thing that we need to do in our clinic in order to provide the best protection that we can to our patients and our team. So regular cleaning of the clinic area should take place and recorded, and records should be kept in each room in a log. So in our clinic we have wipeable cleaning logs on the wall in each room. That includes our offices, our theatre, our exam rooms, etc., our yard. So we know that each day the basic day cleaning has been done. We know the weekly cleaning's been done, and we know the deep cleaning for the monthly cleaning or more regularly has been done. We also keep a cleaning log as well, and it's really important to ensure that the products being used are the most appropriate, so equine specific. This not only is for your sort of exam rooms and theatre, but also for your staff areas. So you probably don't want to be using your equine disinfectant to clean your kitchen after lunchtime. The dilution of the solutions that you're using should be accurate. We don't just want to be glugging lots of disinfectant into a bucket and away we go. We need to be using our pumps and working out what concentration we actually need to be using for the situation that we're dealing with. Fogging should also be done regularly. It's really good to do this and record it and make sure it's done frequently. We tend to do our theatre regularly, we do our inpatient yards regularly, we do our exam rooms, and we also do our office, obviously not when we have staff members in there, but it's just really good to keep the whole clinic clean and get to the bits that you can't reach. Deep cleans of all areas, as I already said, should be regular and it should be logged. There may be a situation where we need to provide evidence that we've done this. And an important thing also, again, not the most exciting topic for someone, but it's important to implement a cleaning audit and checklist. And your stables and exam rooms should be cleaned and disinfected between patients. I know some clinics don't always do that. They do it just once at the end of the day. We find it takes a couple of minutes just to give everywhere a good clean, put some disinfectant around and make that clean and presentable for the patient and the client. So you're creating a safe environment, but you're also creating a good impression for if your client is to come into your exam room. And with regards to the cleaning audits, at our clinic, we tend to do the audit. Well, our practice manager does the audit, so a checklist is carried out. We give this to somebody that's not doing the majority of the cleaning because they're independent to the team carrying out the cleaning. So they can have a sort of an unbiased view as to whether things are being done properly or whether there's anything that we need to improve on. So we keep a log of that, and we tend to find that that helps a lot. So cleanliness and equipment and maintenance. So we've already discussed that transmission of disease can be through fomites. So veterinary equipment is classed as a fomite. So we need to ensure that the equipment is cleaned between cases, and this includes disinfection. So it's not great just to be wiping something over quickly. We actually do need to clean it correctly in between cases. We should also have protocols for cleaning and sterilisation of equipment and instruments, and that should be available to hand in the areas that we're doing it. So in our sterilisation areas, next to our autoclaves, etc. And the training should be given, and people should be confident to do this before carrying it out to make sure it's being done properly. The protocols that we have in place, we should consider these based on the risk, and again, the type of patients we're seeing, the caseload, the type of work that we're doing. Laundry we've already mentioned, but should be carried out in a way that minimises contamination. So sounds again very basic, but you don't want to be washing your theatre scrubs with your rug that's being used on an ISO case. We want to make sure that we've got separation there. We also need to consider zoonosis and the human handling of kit and laundry. So a big one for this would be ringworm and salmonella. So we want to make sure that people are aware of what they're handling and they're using the correct PPE. In our clinics, we should have clean and dirty zones. These should be available for the segregation of used kit. As a nurse, there's nothing worse than if you've just cleaned your nice orthopedic kit after a surgery and someone comes and puts a dirty kit on top of it. We need to make sure that people are aware of where to put things and how to signal that they need to be cleaned. We use colour stickers, so we have red stickers for dirty and green stickers for green and good to go. So that's something to consider, especially in a busy kit when there's lots of people buzzing around and people are looking for jobs. So definitely want to consider. And really important to remember that if kit is damaged, it's actually really difficult to clean and disinfect. So sometimes we may not be able to clean a damaged instrument or a damaged piece of kit correctly because we want to avoid causing further damage. But realistically, we're not able to do the job properly to clean and disinfect it if it's broken. So we need to make sure that there's regular repairs and service is carried out where needed. So we need to consider the correct use of disinfectant. We need to remember that the disinfectant will also be less successful unless cleaning has been carried out first. So sometimes on yards you'll see people thinking that they're doing a really good job disinfecting their stables, but they're actually just spraying disinfectant on dirty surfaces, walls that are covered in fecal matter. Disinfectant really doesn't work as well unless a clean has been done first. So we need to make sure that we've got protocol in place for that. There's also various cleaning and disinfectant products that are available that are specific to equine disease. So ensure you're selecting the correct one. It's often a bit of a minefield when you're ordering disinfectants. There's so many available. Some are more specific to small animal, some perhaps humans, some for equine. As a clinic, we tend to use Steri 7, which is an equine specific one. We find this has been really good. So far, it's done its job and we've not had any issues. So for us, that would be the one to use. We use it to clean. We also use it in the fogger. We use wipes and sprays, etc. So we find that to be a really good disinfectant. Dilutions, as I've already said, depend on the situation. So make sure that you have either a protocol for this or you're using the instructions on the back of whatever you may be using. So it could be that if you're dealing with an isolation situation, you're cleaning after an ISO case, it's probably going to be very different to the dilution that you're using cleaning up the exam room after a routine case. So we need to make sure that we're using the disinfectant correctly. And remember that some disinfectants may not be suitable for all equipment, so you need to check with the manufacturer. This is especially important for things like airway scopes, gastroscopes and surgical kits. We don't want to damage anything with the disinfectant that we're using, so make sure either on the disinfectant that you're using it says it's suitable, or check with the manufacturer of the kit as to what they may recommend you use. So Our clinic yard, the clinic yard's always a busy place, and we're going to have horses coming and going. So obviously there's going to be more risk for us, especially because we're potentially having sick horses coming into the yard. So we need to ensure that we've got an entry policy in place. We need to check vaccine history and carry out a clinical exam on arrival. So when your horses have arrived, it's good practice to let them know once they're on the yard, before they come onto the yard, to go over and meet them at their lorry or trailer, and just have a quick check over of the horse and check the vaccine history if you haven't already got it on the records. So this should be done before the horse is unloaded and brought into the clinic. You can also chat with the owner to see if they have any concerns or anything that's changed. If you're admitting a horse and you notice that potentially there's quite a lot of loose droppings, you need to check with the owner, is this normal for this horse? How long has this been going on? Because we need to remember that stress also causes horses to have loose droppings, so we don't want to be putting everything in ISO unnecessarily. It could just be that the journey, and coming to a new place has caused that horse to pass that loose dropping. So a good chat with the owner to see if there's any concerns that they have is really valuable. We also need to consider the risk factors before allocating a stable. So a sick horse, a mare from a stud, a neonate, or a horse that's been competing abroad. We need to consider where we're placing these stables in horses in our clinic, and what we want them to come into contact with. So not only to protect the horses that we've already got in, but especially with foals, for example, we also want to protect them. So we need to know, we need to work out a plan of where they're going to go. So we can't always do this in emergency situations, but it's a good idea to plan the diary, make sure that we know what's coming in and we can allocate stables for that horse. Ideally, we need to avoid situations where patients can have direct contact. It's not always going to be avoidable in every situation, but if we're designing and building a new clinic, we can try and make this happen. So you need to consider things like grills, full boards, part boards, and what space they have where they can touch each other. Can they touch each other over the side of the partitions? Can they touch each other through the grill? We also need to consider good ventilation. So we want our inpatient yards to have good ventilation. There's various ways we can do this. Windows are also a nice option. Not only does it provide some ventilation, but also it gives the horse a little bit of enrichment if they can put their head out. But again, we don't want to have a horse with a snotty nose that's coughing with its head out of the window when we're trotting up lameness. So we need to make sure that we think about where we're putting these cases. Storage of hay should not be in communal areas. We should keep this separate, and that goes for any feed, etc. as well. And any buckets and equipment that we use should be colour coded and disinfected between use. Hay nets is something that often gets overlooked. If you've got horses that are standing at hay nets and they've got snotty noses or coughing, obviously there's possibility there for disease to be transmitted. So we disinfect our hay nets, make sure they're emptied, and then place them in your disinfectant solution, and just give them a rinse afterwards. Horses' individual belongings should be colour coded. So we don't want to be swapping bits and pieces from horse to horse. And each horse should be allocated into individual rugs, head collars and grooming kit. On arrival, each horse at our clinic gets given its own grooming kit that's labelled and kept outside its stable in a separate bag. This is really important for ringworm. We don't want to be passing things on to clients' horses, so we want to make sure we're using individual kit. Again, it just creates a nice image for the client when they come in and they see that we've got individual kit allocated to their horse. So PPE should be worn and readily available on the yard for use between horses. By this, I don't mean the full biosecurity kit for our basic inpatient yard for our routine cases, but we should wear gloves, and we should definitely be hand washing between cases if we haven't had gloves on. So gloves, hand wash, gel, etc. should be easily accessible to use between cases. And as I've already mentioned, we need to consider the fomites. So one good example is a wheelbarrow between cases. So we muck out horses every day. You know, we often have our vet techs and vet grooms that are going around our inpatient yards. They may muck out 10 horses with the same wheelbarrow. We need to be considering what those horses are touching and sniffing, because it could be a contaminant. And our isolation facilities should be available and separate. Protocol should be in place for this. So when we talk about isolation, there's various reasons why we may isolate a horse. Every clinic might be slightly different, but this is our sort of guide for how we isolate at Lower House. So we will isolate a horse that's been examined and has a temperature of 38.5 degrees and above. So again, it depends on whether that horse has had a diagnosis or not and what we're treating. But as a general rule, if it's got a temperature, we would have that horse separate. A horse that presents with diarrhea of an unknown cause, again, we're not talking about a horse that's come in for a routine procedure and it's passed one pile of loose droppings. This is a horse that's had an outbreak of diarrhea in recent time. A horse that has a low white cell count, so if we've done diagnostics already and we found that white cell count is low, we'll be putting that in isolation, and again, until we know what we're dealing with. And a horse showing signs of respiratory illness. So yes, we could have some horses that are admitted to our clinic for asthma. So, you know, we're not going to be necessarily rushing to put those in isolation, but anything else that's coming in with a respiratory disease that doesn't have a diagnosis, we need to be considering. Horses that have conditions such as asthma, we also need to consider who we are stabling them next to, because obviously they may be a little bit more at risk. And a horse that shows any signs of skin lesions indicative of ringworm or lice, we would put in ISO. Not only is this to protect the spread between other horses, but it's also to safeguard our team due to the zoonosis here. So we don't want our team to be coming in contact with this without PPE. And putting that horse in isolation not only protects the other patients, but it just gives our team a bit of a reminder that you need to pop your relevant PPE on to deal with this horse and ensure that everything is done separate. A horse that has an unknown or lapsed vaccine history, we may not necessarily place this in a strict isolation facility because realistically these horses are more at risk to themselves than they are to our other patients, but we will be looking at where we'd be placing these in the barn. We would be trying to avoid shared airspace. And a horse that has had a recent episode of travelling abroad, again, similar to above, depending on whether there's symptoms and what contact that horse has been with, whether it's been with horses that are symptomatic, we would be segregating this horse from others. So looking at isolation, there's different levels of isolation. Again, every clinic in your biosecurity handbook, you're going to have your own protocols for this, and you're going to differentiate your cases differently depending on what you're seeing. But for us, this is our sort of isolation guide and what we refer to. So to start with, we have our vaccinated healthy patients that have come in for routine procedure. They're not going to be going into our isolation facility. They are going to be treated as normal. You know, we're just going to do the standard PPE, hand washing and gloves. Animals with unknown vaccination history but clinically well. Again, we're going to treat those with caution. And yes, they're more risk to themselves with them being not vaccinated, but also they do pose a risk to others, so we do need to just proceed with caution with these cases. And as I already said, again, the same with the horses that are coming from abroad. So our higher risk cases are our known infectious or suspected infectious cases. So we would here put these into full ISO facilities. So we're going to be looking at our protective clothing, no contact with other horses, with other patients, and full isolation. This is when we're going to start allocating a separate team. We're going to be everything separate for these patients. And the same goes to patients with known or suspected zoonosis. So we've already talked about ringworm, but we've also got to consider salmonella. So these patients are also going to be a risk to our team members taking care of them. So whereas we may not go down the full isolation route with a ringworm case, we would certainly be doing that with a suspected salmonella. And I put at the bottom here that horses are suspected as being contagious. They should be treated as contagious until otherwise proved not. So I know from experience here, our clients are pretty okay with us saying to them, look, your horse has come in, is displaying this and this and this, and this is causing us some concern that this horse may be contagious. So we need to place this horse in our isolation. Most owners are completely on board with this. Yes, there will be a little bit of additional cost for them, and there could be some wasted PPE from our point of view, but for us it's much better to put something in ISO until we know exactly what's going on with it, and then once we're all happy and the diagnosis has been confirmed and our tests have come back negative, we can look at putting that horse into the main yard. So how do you go about setting up an isolation facility at the clinic? Well, again, it's very much unique to each clinic depending on the setup. It depends on the space you have, it depends on your expected caseload, it depends on whether you've got new or old facilities, you're just setting up, you're trying to adapt what you've got. We need to make sure that there's separate airspace. So at our clinic, the isolation facilities are fully boarded. They do have a grill that they can put their head out of, but it goes into a completely separate area that is not in contact with any other horses. They need to be unable to touch other horses. We also need to clearly define our isolation area. So you can see in the picture here, I've taken from Veterinary Island Journal, it's clearly defined. We can see that there's a problem there with the yellow and black markings, with, you can't access that stable. If I went into that clinic, I certainly wouldn't be going there. It's clearly an isolation area. We also need to have our risk factor displayed. So going back to the slide I just previously went through, we should have a sign that says isolation, but we should also display the risk factor so our team members know exactly what we're dealing with. Are we dealing with a horse that has a very minor problem, or are we dealing with a salmonella outbreak? You need to display your risk factor so people know what to do and what to expect when they are going into the isolation facilities. Separate equipment is necessary, so we should be using everything separate for these horses, separate mucking out equipment, separate wheelbarrow, separate grooming kits. Everything that we need to use should be separate. We should also consider our muck, waste, bedding and clinical waste disposal and storage. Again, this is really important because if we've got something that is contagious, especially if it's a zoonosis, where are we putting this contaminated bedding? So we don't want to be worrying about this in the middle of the night. We need to have a plan in place, and we need to know where this bedding's going, and everyone needs to be aware of what we're doing. Our clinic is quite unique in that we are based right next door to a livery yard, so we have to be especially careful when we have isolation cases in, that we manage very well. So while none of the liveries can have access into our clinic, but we still are on the same farm, so we need to make sure that our bedding is disposed appropriately when we have these cases in. There should be hand washing facilities available, so we don't want to be coming out of ISO and walking through the clinic to wash our hands. There should be hand washing facilities, or at least some kind of gel nearby. And we should have appropriate PPE on standby. Again, we need this to be outside of ISO. We don't want to be rooting around in the clinic looking for some while we're contaminated. And we should keep our isolation protocol on hand as well. That should be placed outside or near the isolation facility, so that we can refer back to it. We may have people that haven't worked with an ISO case before, we may have new staff, so we need to make sure that that isolation case is on, isolation protocol is on hand. And it's important to remember that in times like these where potentially people might be a little bit stressed, we can't always remember everything, so again, a quick flick of the protocol helps us all to know that we're on the same page. So here are a few pointers. So remember your foot dip. It's really important where you position your foot dip. You don't want to have it, you want to have it as close to the exit as your isolation facility as you come out of your stable. So come out of your stable straight into your foot dip. Medication and equipment trolley, that should only be equipped with what's needed. So we don't want to waste your your consumables such as your needles, syringes, etc. So only take what you need and stock up your trolley so things are readily available to deal with that case. Again, there's nothing worse than being in full ISO suit and needing to get something from the pharmacy. So make sure that you have separate storage and allocation to that patient what you might need. Our patients need to be comfortable, they need to feel at home, they need to feel better, so we need to help with that. So we may have to provide some kind of fan, a heater, we may have to have electric there, so if potentially we wanted to do an ultrasound scan on a horse with colitis, we might need electric for our scanner. We also need to have fluid hangers. Likely horses that are in there are going to be requiring fluids at some point, so fluid hangers should be available and good to go. The area should also have room, ideally at least one of our stables, or if it's the only stable that we have, should be sufficient space to fit a mare and foal, because there may be occasions where we're treating the mare and the foal and we need to isolate them both, or we need to treat the mare but the foal needs to come along, so we need to make sure that there's room. We also have to consider that donkeys travel in twos often, so we need to ensure that there's plenty of space to potentially hold 2 horses if they're used to being with 2. So that would usually be your mare and foal or your donkey and its companion. Wooden stables are a bit tricky in ISO as they're difficult to clean, difficult to maintain, so probably would avoid those if possible if you're starting to build your clinic from scratch. If you are having to adapt a wooden stable into an isolation facility, you can buy things like parlour boards which you can place over the top of your wooden partitions. They can create a wipeable and washable surface, so there's options that if you've got wooden stables and that's all you've got to work with, there's ways that we can adapt that to make them better for cleaning. We need to make sure that we have staff allocated to these cases, so the bare minimum, we need your vet tech or groom that's going to be carrying out their daily mucking out and care, so they'll be in with that horse several times throughout the day with feed, bedding, grooming, etc. And we also need the treating vet. So that would be your bare minimum for an isolation case, but usually you'd also have a nurse, potentially your intern, etc. So we need to try and limit the amount of staff that we're allowing into the isolation facility, but we also need to ensure that that horse is still receiving the appropriate veterinary care based on the staff that we're allocating. We need to consider the access, so we don't ever want our clients to have access to our isolation facility. There will be occasions where they're going to have to go in there, for example, if unfortunately the horse isn't doing very well and we may need to be making some decisions. We probably are going to have to allow the owners in. Again, we can give them PPE and we can give them some training, but we need to consider who can access that facility easily, so we need to make sure that it's separate, it's out of the way, and it's clearly defined that it's an isolation area. And lastly, we need to consider the options that we have if the horse unfortunately needs to be euthanized in the stable. It may happen, it may often be easier to euthanize a horse that's contagious in the stable instead of taking it somewhere else in the clinic. So we need to consider, can we get that horse out once it's been euthanized and onto the transport? Is there adequate space and adequate facilities to do this? We may need to think of things like winches and how we can get a lorry to back up towards that stable. We also need to make sure that we notify our collection companies about these cases, and usually calling them before to make sure that they're aware and they're happy to take the case is good as well. So keeping everyone involved is often the best way forward. When we've had this situation before, we've just made sure that we've given the driver PPE and we've given the sort of full rundown of what's been going on with that horse, and generally they've been very cooperative and happy to proceed. So here's an example of an equine isolation facilities, thanks to the team at Lea Hurst Equine Hospital who kindly provided me these photographs. So everything you can see here is what I've just discussed. So in the middle there, you've got your isolation yard. It's clearly defined. You can see that there's provisions to cordon that area off when they need to. Above, you can see their consumables and a small pharmacy stock that's in the isolation facility. So they've got their temperature monitoring there as well. So we need to remember that although we've taken things out of the pharmacy, we still need to treat them the same. Separate provisions there for mucking out, hand washing facilities and some PPE, and also a cleaning kit you can see on the right hand side. So this is a really lovely setup. I know Lea Hurst are equipped to take a number of isolation cases at once, so this is a really good way to demonstrate what we should all be aiming for with our isolation facilities. But again, it very much depends on what you have at your clinic, and there are ways to work around many setups. As long as we follow our protocols for biosecurity, it's possible to have an isolation facility in most clinics. So going on now to ambulatory visits for vets and nurses and what we need to consider for biosecurity in these situations. Not all of us will be working in the clinic. Ambulatory visits may be the norm for us day in, day out. So this, we may be ambulatory based only. So again, just because we're out of the clinic, we still need to consider biosecurity and how we can help prevent any spread. And again, maintaining a really professional image. So ambulatory vets and nurses are going to be visiting multiple yards on the same day and handling a variety of patients. So we're increasing our risk here by doing this, so we need to take precautions. We also need to maintain a clean and professional appearance. So not only does this reduce spread, but it also creates an overall good impression of the steps we're taking to promote good biosecurity. So I often say this to our team here at the clinic, that first impressions really do count. We need to, when we arrive on the yard, we need to make sure our car is clean. I know it's very difficult when you're driving around between calls. Often it's dusty, dirty, we're potentially having to go through mud, especially in the winter. So we need to make sure that we allocate time in the vet's diaries to keep the vehicles clean. Not only on the inside, but also not only on the outside, but also on the inside as well. So we should have clean, well-stocked cars that are organised in a neat and tidy way. There should be the provision to segregate waste and sharps, facilities to store any biosecurity stuff that we might need. It should be organised, and it just again creates a good impression to the client. I think I've gone over this quite a few times now, but personal appearance is really good. Vets and nurses should ensure that they're clean and presentable, and overalls and PPE should be changed between cases. And the cleanliness of the team and disinfecting of the kit on yards, it should not only be done, but it's really important that it's seen to be done by our clients to keep them at ease. Often if I've been out on ambulatory visits as a nurse, the clients will often wander back to the car with me, and they always seem to look quite reassured when I'm using my hand gels, etc. I'm separating my waste, my boots nice and clean, I've cleaned my stethoscope. There's ways to just make a really good impression at the same time as doing our bit for our patients and our clients. So overall, making sure these first impressions count is beneficial to everybody. So on ambulatory visits, we're still going to be using kit and equipment, and it's important that we don't just think that kit gets cleaned at the clinic. You should also have in your vehicles a biosecurity kit. So we tend to stock PPE, so gloves, and we have some coveralls, disinfectant, so this would be in a solution, and wipes, a sponge and brush, because when we do need to clean things, although again it sounds very obvious, we need something to clean with. Clinical waste provisions for any potential infectious waste as well. Hand gel is handy to have, and a protocol in the vet's car pack for cleaning and any potential infectious cases. So it may be that you've got new grads or even new vets that have joined your team. They've gone on a yard, they've seen a horse that they think might be infectious, not quite sure what to do. So if it's in their vet car pack, they can quickly refer, they know how to deal with the situation and what to use. and it just makes it a lot less stressful for the team when they come across these situations. I put a picture of a dental kit here. Dental kit is something that we use regularly on yards. Some clinics do offers, so potentially if there's X amount of numbers of horses on a yard having dentals, they have free visits, etc. So we encourage clients to group together to have a cheaper visit. So we're going to be sharing this kit out between the horses that we're seeing. And often these horses aren't owned by the same people. Sometimes they're not based on the same areas of the yard. They're not turned out together. They don't usually come into contact with each other. So it's really important in between these cases, we're cleaning our kit. Dental kits are a big one. So you need to have your disinfectant, your brush, make sure you give it a good clean. Not only that, but when the client is waiting for you, you've finished your first horse, you're going on to your second that's owned by someone else. For them, seeing you clean your kit and taking pride in it, again, it's really reassuring for them to see. So not only is it helping our patients, but it's also a good image for the clinic. So when we look at scheduling our ambulatory appointments, we need to consider appointments where infectious and contagious patients may be examined, and we need to ideally schedule those for the end of the day. We don't want the welfare to be compromised with these patients. So if a horse is sick, as well as being potentially infectious and contagious, we still need to see that urgently. And to make this happen, provision needs to be made for the attending team to go home and change and decontaminate after these cases. So often we may need to have a shuffle of the diary. So again, this is where our reception and admin team need prior training. They need to be able to identify on the phone if potentially somebody is worried by something that may be contagious. They also need to be understanding when the vet says to them, I've seen this horse, I can't go on to the next, I need to pop home. They need to be able to explain to the client that potentially that vet's running late and explain why. Obviously we need to maintain confidentiality, but often if you explain to the clients that this is the reason we're having to shuffle the visit round a little bit, they're generally very understanding. So going on to supporting our clients and how we can do this with biosecurity, it's really important that we consider this as part of our roles as veterinary staff. We want to help our clients with biosecurity because fundamentally we're starting to reduce the spread of disease from the start. So if we can get really good provisions in place on our client yards, we're going to make life easier for everyone involved. So how can we support our clients and patients on their own yards? Well, firstly, we need to educate them and we need to provide talks and demonstrations on biosecurity. Biosecurity isn't always going to be a headline act for a client event, so perhaps combine it with something more interesting. So if you've got a few speakers on the night, slotting a biosecurity talk into the middle of it is often a good way to go. It's not something people will go to solely for, so make sure you integrate it somehow. But from when we've given talks on this area in the past, we've generally got really good feedback, and it's things that clients haven't considered. So it's definitely worth including it on your client evening lists. Social media and websites are really good also to help educate clients. So by this, I don't mean to start sharing that Mr. Jones down the road has got a strangles outbreak. It's more to educate clients on the symptoms, what they can look out for, how they can improve biosecurity on their yard, and little steps that they can take. And not only that, but it also helps it become a non-taboo subject. So if we all talk about it and we're seen to be promoting it, it's often taken better by the clients. We can also provide yard assessments for biosecurity to help implement structure prior to an issue, and this is something I'm going to discuss in a minute. And we can support the clients and yard through an outbreak. So this is going to be a really, really stressful time for these clients, especially if they're on a professional yard, a dealing yard, a competition yard. Potentially they're going to have to close down their facilities. We must remember that these clients are going to be under a lot of pressure. It's their source of income, it's their reputation. So we need to be on the end of the phone. We need to be available to go to the yard to help support them through any kind of outbreak that they may have, and try and be as positive as possible about this. And again, we also need to remember about confidentiality for these situations. So how do we go about formulating a yard biosecurity plan? So we've looked at how we formulate things at the clinic, but on our clients' yards, it's equally as important. So by formulating these plans, we're going to help prevent the induction and spread of infectious disease. And the aim is to clearly identify what particular concerns and disease transmission risks exist for an individual animal, herd and premises. So just like we discussed with the clinic, this isn't going to be a one fit solution for every single yard. It's also a great way to interact with our clients. It's good for nurses to do as well. It's a really nice ambulatory visit for a nurse to go on. So we're improving our clients' communication, but we're also improving patients' welfare. So often we may be offering these as a complementary service, especially to larger yards. It's not a bad idea if you suddenly get a large livery yard on your books, or potentially a new competition yard, a complementary call perhaps from your practice manager to offer them a biosecurity assessment. It goes down really well with clients. Often veterinary professionals are associated with large bills, so we can offer this. If we can offer this as a service, it definitely creates a good foundation of a relationship. So not only are we there obviously to produce invoices for them, but we're also there to help and support them with other areas. So there may also be times when you are asked to provide your services for help with biosecurity for a fee. So you may be asked by an organisation or a showground, or you may even be asked by someone externally to give a presentation. So we need to consider the possibility of earning some money from this too. But overall, I think clients really appreciate it if this is a complimentary service. And again, especially a really good job for a nurse to do for a yard visit. So prior to the visit, we need to ascertain what type of yard it is and what the owners want to achieve. And also before we go, we need to make sure that we've designed a checklist and template that we're going to achieve on our visit. The aim isn't necessarily to walk around with a clipboard and look very formal. It's more just to sort of have there so that we can follow some guide and we can make some notes. So we need to formulate our yard biosecurity plan with the client. So as a general overview, we need to consider the types of equines that are on the yard. We may have new arrivals, so we consider isolation, quarantine. We might have some long-standing residents. There may be some competing horses, which obviously come with additional risks. We may have vulnerable horses, so older horses, unwell horses, horses with certain diseases already. We may have breeding horses, again, a little bit more risk on studs. And we could have visiting horses, so these might be there for breaking, training, schooling, or potentially horses coming on site for lessons and competitions. So on some yards, we might find all of the above, or there may only be one type, but there's probably always going to be new arrivals, apart from at your sort of private, single horse or two horse yard. Generally, there's also always going to be some type of horse coming and going at some point. So things to consider in your risk assessment, we need to look at an overview of the yard. Again, just like planning our clinic biosecurity protocol, we need to have a person with overall responsibility. We need to consider the location of this yard. So is it close to a competition centre, another livery yard? Is it isolated? We need to consider the amount of horses, whether it's private or professional, whether it's a competition, leisure, mixed yard, or whether it's a breeding facility. And when we look at our facilities and the management of these, we need to consider who has access. So are there any rights of way? Are there any bridle ways that pass through the facilities? Access points, how many access points are there? If we can limit that, that also helps. Parking areas, so if horses are coming to visit, say to use facilities, are there separate parking areas that are away from our normal horses that are housed there? What type of buildings they have? Are they going to be easy to manage horses in a situation of an outbreak of these buildings? Can you segregate areas? What type of ventilation is available? This is very important. And how the stables are in terms of grills, dividers, how much contact horses can have with each other. Again, just looking at some forward planning for if we do need to segregate and consider new arrivals. And lastly, we also need to consider the paddocks. So hygiene and cleaning, who's going to be mucking out and handling these horses, and what about any cross-contamination and equipment sharing? Large yards often have zones, so they'll have colour coordination in different zones of the facility, so they try and minimise what's cross-contaminated. Are there any cleaning protocols on the yard, not only for the horse area and the muck heap, but also for the staff areas as well? And muck heap management, so is it collected? How do they dispose of their waste? How clean is the yard? I usually make a bit of an assessment of that as soon as I arrive. You can usually tell the difference between a professional is usually immaculate, whereas opposed to some yards you go to and it looks like there's never been any sweeping, etc. done. So you do tend to build a little bit of an impression yourself, just like we discussed before, how first impressions count. So the human facilities, what's available, hand washing, toilet facilities, etc. And again, is there one barn or are there zones? And how are they storing their feed and hay? We need to consider the water management. So water troughs are a big source of contamination. So often you'll see fields, paddocks where the water troughs are shared between a couple of fields, or are they automatic drinkers, etc. in the stables. Then we need to consider the vaccination policy. So what vaccination policies have they got in place, and how is this monitored? And what vaccines are required for the horses on this yard, depending on the risk. So we may look at, some owners go, if it's a private yard, they may just be using tetanus, although we don't tend to advise them to admit the flu. They may do this for cost-saving reasons if the horses aren't going anywhere. So flu would be normal. And on some yards, competition yards, studs, etc., we would also recommend EHV. Is there good parasite management? So fecal egg counting, is that carried out? Is there deworming when necessary? And is there regular paddock maintenance, so poo picking, etc.? And then we need to consider what this yard does when new horses arrive. So we need to have a new horse entry protocol drawn up for them. So do they have isolation or quarantine facilities? Is there pre-entry requirements? So what are their pre-entry requirements? Do they want to see a vaccine history? Some yards request blood testing and swabs. And how often and how many new arrivals? Are there suitable facilities to accommodate the new arrivals? So how are we separating these horses? What's their isolation period? Most people go with 21 days, but what do they have in mind on this yard and what are their reasonings for it? Who's going to be caring for these new animals? Will it be an individual staff? Will it be multiple staff? Or will the owner be coming to care for the animal? Will these horses have some turnout? So yes, we need to put them separate, but they still need some enrichment. So will they have some turnout? Are any horses likely to be returning from abroad, or are they going to be returning from stud? And are they often going to what we refer to as stay away shows? So staying over at competition centres in the UK, we still need to assess the risk prior to the horse leaving and returning. And again, obviously the same for horses that are coming from abroad. So it's good to help us set up an entry or quarantine isolation area for our clients. When we look at the facilities in our clinic, we will refer to isolation, where we put our sick horses and our potentially infectious, contagious horses. On yards, probably we should be referring to it as quarantine for new arrivals. The above words are often used incorrectly, so I personally feel that clients are a lot more accepting of the word quarantine rather than isolation when arriving at a new yard. Isolation to a layperson often implies that the horse has a disease, but quarantine may be seen as more of an entry procedure, so they're more willing to do it. But it's really important, whether you're using the term isolation or quarantine, that we still follow the strict procedures and protocols for these horses that are coming onto this yard. So what do we do if we have a disease outbreak? We need to have a plan in place ready for this. So we need to assess the facilities and practicalities for a disease outbreak. It's so much better to do this as part of a biosecurity plan than try and do it when you're in the middle of an outbreak. If you can have something drawn up already, it's a lot quicker to act and get these horses segregated. So we need to discuss with the client their plan and consider the pros and cons, and consider any additional kit that needs to be purchased to help make this work. We also need to consider any adaptations that need to be made. So As well as that, we need to consider during an outbreak care for horses that have had no contact with the disease, horses that have had contact but have no symptoms, and horses that are symptomatic. So these are three groups of horses that we're potentially going to have to keep separately. So we need to make sure that there's provisions for this. So just some risk factors here with regards to new arrivals to a yard. There's going to be different levels of risk depending on what type of yard and the horse is arriving. So, for example, a horse dealing yard, there's going to be new arrivals regularly. Often these horses have been passed around a little bit before, so they're potentially going to have been on multiple yards. Probably going to be public interaction with these horses because potentially people are coming to view them for sales. This is going to be more regular. On a stud, we've obviously got the risk of mares for foaling or to be covered. Horse breaking and schooling yard, again, regular new arrivals. Often horses are there for sort of 2 to 6 weeks, so we're going to have change of horses into stables quite regularly. Often these yards don't have the facility for isolation or quarantine, so we need to consider what they're doing and how we can improve it. Competition yards, horses are going to be mixing at shows, both in the UK and abroad, and also during transport. Livery yards, the issue here is we're going to have multiple owners, so potentially, you know, going from horse to some extent, and also some competitive riders that may be again going to shows, even stay away shows. Some livery yards will have riders, amateur riders that will also want to compete abroad. Riding schools are a little less risk. We may have new arrivals occasionally, but the main risk here is the public interaction, and also often you'll see slightly older horses on riding schools, so potentially we need to consider them as well and what risk it is to them. And then your private leisure yards, low risk, but we should still educate. Often your private horse owner will have maybe 1, 2, 3, 4 horses. They also need to know what they need to do when they buy a new horse. So just because it's come from, say, another amateur, another private person, we still need to consider where that horse has been and how we implement it into our home yard. So when looking at your entry protocol for these horses, just a little bit more on this. Prior to arrival, vaccination status should definitely be confirmed. Some yards opt for the S-equi blood sample, so the strangle blood sample, although the current thought suggests that this may not be the most useful for entry and movement testing due to false positives and not confirming carrier or disease status. So the most accurate method would be to guttural pouch wash. We do this quite regularly onto one of our rescue centre yards. So as soon as they're admitted, they go into isolation, and then we guttural pouch wash them while they're in isolation, and that works really well. Horses really should be in quarantine for 21 days. Regular temperature monitoring should be carried out. And horses should be separate, but they should still have access to a quarantine paddock and receive the same standard of care. So these horses, yes, they're in their quarantine, but they still need to stretch their legs and they still need to be cared for correctly. So we need to make sure we have the provisions in place for this. And the area should be separate with separate equipment. Clothing change if the same member of staff is also doing the rest of the yard. And again, really important to ensure that it's separate airspace from the other horses. So some people may be left with the only option that they have to have a new horse at a separate end of a barn from all the other horses, but where possible we want to have these horses in a separate building. So this was just a really good handout that Beaver made, so the British Equine Veterinary Association, that you can give out to clients. It just goes through everything that we said regarding introducing a new horse at the yard to prevent the spread of disease. So again, really handy to print this out. They can be found on the Beaver website if you're a member, and you can have these for your clients. They can stick this up in the yard. So once you've carried out your risk assessments and you've gone through biosecurity and you've made all of your assessments of your client's yard in order to help them formulate a plan, we need to give some feedback. We need to provide practical and sensible recommendations. And there's a few yards really that are going to be able to implement all the potential biosecurity measures, but really just a few targeted measures based on the risk profile of the yard makes a big improvement overall for the biosecurity. So we can probably spot lots of things, and we can't turn everything into a really fancy place where we can carry out optimum biosecurity, but we can implement a few changes that are going to make a big difference. So remember also, biosecurity can be an awkward topic with our owners if the client thinks they're already doing things well. Also, when you're contacting them to ask whether they would like a biosecurity assessment, some may take offence to this. They may think that we're implying that they're not doing things well, so we need to approach this topic in a careful way. And it's important to present your findings as things to improve, so don't make it negative. We need to outline the positives. As you do with most things, make sure that we look at the ways to improve things. And education is important, so don't give the client a list of things to purchase or change without any explanation as to why. Again, this may cause a little bit of offence, or it might cause the client a bit of stress, so make sure we sit down with these clients and go through why we want them to do the things we've suggested. Further support and education with vaccine, worming and new entry protocol may be needed, so we may need to go and have further discussions with them about this to help get them on board. And for large yards at your clinic, you should allocate a trained point of contact who can provide assistance in an outbreak. Again, this is a great role for a veterinary nurse, and ideally it would be the same person that carried out the biosecurity assessment at this yard. So just to finalise now, a little bit on how we can test for disease. So when we look at testing for disease, we're talking at preventative, so we briefly touched on pre-movement testing and also during an outbreak. So early recognition of clinical signs from your clinical exam is really important. So if you can pick up these cases based on what your client's telling you and what you're seeing with the horses, it's good to get this spotted quickly. So then we can carry out rapid testing to confirm diagnosis. And we can also consider potential testing of any in-contact animals to detect spread. So once we're suspicious or we've got a positive, we can then work out who's been in contact, and we can get some action taken quickly to try and get this under control. And we need to make sure that we carry out the appropriate testing for each suspected case. So we don't want to be testing for everything. We want to really look at what we need to do, what symptoms we're presented with, and test for the most likely. This also is trying to reduce costs for clients as well. So nasopharyngeal swabs are a good way to test. We usually then carry out PCR on these, although there is option for culture and virus isolation if needed. We can also swab infected material, so feces, nasal discharge, abscess or aborted tissue. Again, this is usually PCR, although culture is possible. Blood sampling can be carried out. This can be ELISA or virus isolation. And as I previously mentioned, guttural pouch sampling for strangles. This is to determine carrier status. It's gold standard with PCR. Again, also possible. You may find that some yards request these pre-movement strangles blood tests, and then based on the results, if it looks like you've got raised levels, you may then have to go back and do a guttural pouch sample as well. So we would usually go straight for the guttural pouch now. Again, as I said, on our rescue centre, we find that really beneficial and a lot quicker and easier for the staff there as well. So just to summarise now, so effective biosecurity minimises disease outbreaks, protects horses, protects horse population, and ensures the safety of veterinary professionals as well, horse owners and the equine community as a whole. We need to practice and implement good standards of biosecurity. We should be seen to practice and implement good standards of biosecurity. So again, make sure you're doing this and it's visible. We need to be ready to admit or refer a potentially infectious case. So make sure your protocols are in place, your isolation is ready to go, easy to set up, and your team know how to do it, or know where to refer your potentially infectious cases to. Not every clinic has an isolation facility. We need to have a practice biosecurity plan. I think from this evening, I hope that everybody will formulate one of those. And again, importantly, we need to provide internal and external CPD to educate the team, and also, again, educate the clients, social media, websites and client events. And we need to promote biosecurity yard assessments. Mentioned it before, being a nurse, it's obviously something I'm quite interested in, but it's a really good job for your equine nurses to do in practice. Vaccination protocols, assess each yard and situation and give the appropriate advice to the client. And with testing, consider benefits of pre-movement testing and familiarise yourself with the tests available for rapid diagnosis. And ensure that your vehicles are stocked with biosecurity kit. So that's the end of the presentation. Thank you very much for listening. I just wanted to say that, as Lisa already mentioned at the start, that the presentation has been given return for a donation from HORIBA to Beaver Trust, of which I'm a committee member. So if you'd like to find more about what they do, then just visit the website, which is listed there. And again, a big thank you to my colleagues at Lower House Equine Clinic for putting up with my high expectations on biosecurity and doing a great job here with keeping our clinic very clean and tidy.
Thanks so much to Cassie for your presentation. That was absolutely brilliant, and so many practical tips and so much information there about equine biosecurity, which I know from having worked with you is a subject very, very close to your heart. And I think we've realised that it's as much about the communication as well as about the practical steps that people can take in their clinics. You know, it's about having the protocols in place and making sure that they're really effectively communicated as well. So Cassie's going to stay with us for a little while to answer any questions or to receive any feedback that we've got from the audience. So thanks to everybody who's joined us also this evening. We've all had a long day at work already, but if you do have any questions, feedback or comments, please feel free to pop them in the chat box on the screen, and we will cover as many of those as we can. We did say we would run till about 9 o'clock, which we're approaching already. But Cassie's kindly agreed to stay on just to ensure that any questions that come in live are answered. And if you're watching back afterwards, watching the recording, and you have questions for us or for Cassie, you will see on the screen there that you've got contact details for us. So you're very welcome to get in touch, and we can communicate with Cassie also if you have specific questions for her after the event, if you're watching the live recording. So I think, as to touch back again around the communication, we've seen that when I've visited Lower House Equine, that you really walk the walk as well as talk the talk, that it's communicated all through the practice. And is that something you have as part of your induction protocols for your new staff?
Yeah, we definitely do, yeah. So all the staff actually, so whether it's our reception team, you know, our vet techs, nurses, vets, yeah, we definitely make sure it's part of the induction process, because it's difficult enough when you start a new team into a new team anyway, and I think there's nothing worse than being at work and doing something and not quite knowing how to do it, so or getting it wrong, or you know, not understanding. So we just try and implement it from the start so we know everyone's working to the same standard. So yeah, that's definitely something I would advise including on your induction.
Okay, excellent, thank you. And what's your process for reviewing your protocols, Cassie? How do you obviously you set something in place, then what's your ongoing process then?
So they're reviewed every year. We obviously have to do quite a bit for practice standards anyway, and then they're sort of adapted with regards to the cases that we have in, or any issues that we've encountered, or any CPD that we've been on, or you know, any publications that we've read. So we try and just implement changes as and when they arise, and if we find that there's something that we've not covered, we'll add it in, or if we find that there's a case that we've maybe not dealt with, or something that's happened that we've not dealt with before, we'll try and implement that somehow as well. So regularly updated, and then yeah, updated as much as we need to, really.
Okay, so that kind of review of any outbreaks or cases that you've had in the clinic will also form part of your process as just your usual discussions within the staff there.
Yeah, so usually within our clinical meetings, we could discuss it as well, and then I might discuss it with our vet techs and grooms, just, you know, if there's something we can improve on or learn from. We tend to have quite open meetings if we need to, you know, like you know, a no blame culture, etc. So yeah, anything that we can do to implement a positive change is always good.
Oh, excellent. Thank you for that. And also about your client evenings as well. I know that you mentioned that as part of the presentation, and I understand that's something you do quite regularly at Lower House.
Yeah. Yeah, so we do lots of different topics. I think I mentioned in the talk previously, I think if you had a client evening that was just entitled biosecurity, you probably wouldn't get lots of clients attending. So what we try and do is the last time we did it is we tied it in with I think we did something on PPID and the veteran horse, and they're quite popular topics for our clients. So and then I did a talk on biosecurity, and I called it "How Clean Is Your Stable?" So it just created a little bit of interest. Again, I found not calling it biosecurity seemed to attract, and because it was in the middle and it was before food, they had to listen. So it worked quite well.
That sounds like a really great piece of planning, and I have to agree, biosecurity, it does sound perhaps slightly alarmist. You know, in a clinical context we understand it and its importance, but perhaps for, you know, for clients, yard owners, pony owners, you know, it sounds a little bit alarmist. So I think when we package it more as around disease prevention, around protecting the welfare of your horse, you know, outbreaks of disease are certainly inconvenient and can be costly as well. So if there are things that we can do to introduce best practice both clinically and for our every single horse and every single owner or the people that are handling the horses, and reduce costs, reduce disease outbreak, however we package it, we're all looking for the same thing ultimately. So I like the stealthy approach of packaging it with other things, and I don't think there's a horse owner out there that wouldn't want to do a good job for their horse. Also, you know, they don't want to perhaps admit that maybe they've got concerns about biosecurity. So I think your proactive approach of offering a review, you know, a hygiene review or a review of their protocols is a really nice way to do things and to help build up the communication, the relationship you've got with the customers. So is that something that you do routinely?
I think it goes back to a lot of the things that we've done with Beaver and the addition of the ambulatory nurse role in practice. So again, it's something that I think we considered more when we were looking at what nurses could do on ambulatory visits. So they can do, you know, blood sampling, radiography, bandage changes, etc. But also we do things like weight clinics. So the biosecurity assessment, in a way, it can be similar to a weight clinic. You can get your, you know, livery yard or whatever, or your big competition yard, and you can go and have a day there, well, not necessarily a day, but, you know, a few hours with them to try and give them some advice. And a little bit like the weight clinics, we don't charge for that. It goes down really well with the clients. They all enjoy it. They get a lot out of it. So I think the same could be done for, you know, like a yard biosecurity assessment. And I think if we can bill it that we're trying to do this to help you in case something does happen, so we're all prepared, I think it's a much better way of going about it. Not phoning them and saying, oh, your yard looked a bit grubby last time I was there, so can I come and have a nosy and tell you what you're doing wrong? I don't think that's the way to go about it. I think if we can try and make it a positive thing, it's good for the clients, just like the weight clinics.
Absolutely. I think again it comes around back to this communication, doesn't it? You know, how we package things and normalizing really good hygiene control, biosecurity. We've learnt more in recent times about you know, pre-movement testing with the PCR testing now for strangles, that we can do that much more quickly. And it's less alarmist now, you know, that if we can manage things and minimise outbreaks and the impact of them, then that's good for everybody. We have a couple of comments come in, just feedback on the presentation. Brilliant, thank you. Great to see you focusing on the basics. And I think, yeah, that the whole protocol around cleaning, that not just using a disinfectant, but making sure we're removing dirt and debris first, and using a multi-faceted approach to cleaning, making sure we're using the right products in the right area at the right concentrations is absolutely key. So it's good to hear that there's good feedback on that. If there are any questions, we will be drawing to a close fairly soon. If there's anything else that you want to pop in the chat, then please do it soon, because we'll be closing before too long. And you've also pointed out, Cassie, there's a number of resources available as well. So some of the BEVA resources that are available for members and things that you've referenced in the talk as well.
Yeah, so on the British Equine Veterinary Association website, if you're a member, you can log on, and there's the resources section. So there's actually a section, I think it's biosecurity or infectious disease, but you can, just like the handout that I had in my presentation, there's lots of things you can print out for your clients, or for you as well. There's some clinic plans and things too. So there's templates, so there's lots of stuff on there that's really useful, and I know they're adding more stuff all the time, so it's just a really useful resource. Also the textbook of veterinary nursing is really good as well. That's something that, you know, we refer to. There's actually just been a new textbook of veterinary nursing that's been published, so yeah, lots of up-to-date things in there too. So all places like that to get good resources. I do find that often the nurse literature is a little bit better for things like biosecurity, because we're taught it at college and we probably need to know it to implement it in the clinic. So even vets referring to some of the nurse books isn't a bad thing, because it definitely helps explain it in a very good way.
That's really helpful to know, thank you. And coming from somebody who's managed biosecurity, not only in a clinic, you know, you have quite a varied caseload where you are, but also in field events as well. We were talking just before we started this evening about Cassie's involvement with the BEVA Trust and some of the field events that they do, which are around health assessments, around surgical procedures in a field setting. So to manage all of that remotely, take all of the kit with you, you know, from start to finish, and ensure that the biosecurity of the people, the horses, is maintained in quite challenging circumstances, it is really admirable. I think, you know, that the BEVA Trust are very grateful for that and all of the hard work that you do. So unless we have any further questions or comments come in, we'll draw to a close. Just a couple of other points to make around EIDS, who we mentioned at the very beginning of the introduction this evening. So HORIBA do work with EIDS around infectious disease reporting and supporting anyone who's dealing with a confirmed or suspected outbreak. They're a brilliant team, a huge amount of knowledge there, and are really keen to help any practitioners who want assistance around infectious disease. So please feel free to engage with them, whether that's around advice or reporting. And also then, just to touch again on the BEVA Trust, Cassie has very kindly donated her speaker fee this evening to the Trust. They're always looking for additional volunteers with equine experience. So if you would like to get involved, there's some details there on the screen. So feel free to contact them and see if you're able to help. So HORIBA and the team will be attending some events later this year. We'll be at BVA Live, the BEVA Congress in Birmingham this year, ECVCP, which is all around veterinary pathology, and the London Vet Show later this year. So if you'd like to come and find out a little bit more about what we do, then please do. And if you have any particular subjects that you would like to see covered as part of any future webinars, or if you have a desire to speak, that's how we managed to engage Cassie, was from working together, and she agreed to speak for us on this area of expertise that she has. So if there's anything else that you'd like to know about, then please get in touch. We'll be very pleased to look at future webinars and future speakers. So thank you again for joining us today. It's been a pleasure to engage with Cassie and the Lower House team as part of the presentation, and we wish you a safe rest of your day. Thank you.
Thank you. Bye.
Bye-bye.